been doing at the Trust specifically, and then areas to build on, and a bit of time for Q&A. Yeah, just to note this session has been recorded. If you've got any questions as you're going through, please put them in the chat, but we'll have time at the end for Q&A as well. So a bit of background about our trust. So this is a picture of the main hospital site in Norwich, or slightly to the west of Norwich. It's quite a big site. We're a hospital that's over 250 years old. We've got 11,000 staff, so a big trust. We've got 1,200 beds, one of the largest inpatient hospitals in the UK. Our turnover is 850 million, so creeping closer to that billion mark. And we're part of a wider Norwich Research Park, so we've got links with the University of East Anglia, Quadram Institute, John Innes. There's lots of other organisations on the Research Park site. And actually this picture has, if you took it now, it'd be updated. So there's a new ward block that's been built recently to the site. There's interventional radiology unit, which has been built on top of the roof on one of the bits of the site. And we've also got a elective surgery centre that's being built at the moment. So it's constantly expanding. We did used to have a site in town, but we sort of outgrew that about 20 years ago. So this site is about 20 years old, but it's continually being added onto. So, we've got a lot of staff to educate, really, lots of people to work with from a finance point of view, lots of specialties and lots of areas that, finance needs to be engaged with. This is a picture of our finance team. So, well, some of our finance team, the full team's about 55. So we're pictured here in our site in town. So we've got an office in Norwich City Centre, which is away from the main hospital site. We've got our level 1 and level 2 future focused finance accreditation and our finance director declaration. We're currently working towards level 3. There's a small team that's been working on that. I guess one of the sort of challenges with the team recently is we've upgraded to a new finance system across the ICB. So it's not only finance that have needed to be up to speed with the new finance system that's coming in, but also ensuring that the non-finance colleagues around the trust are up to date and have all the learning and development they need as well to do their jobs properly. So what is FACE? Bit of a reminder here, probably a refresher for people. So finance and clinical educators are people that are committed to demystifying NHS finance and improving clinical care, clinical value. So coming into the NHS from the outside, you sort of realise how complex things can be within NHS as a wider body, but also within systems and organisations as well. So I think it's important for finance staff to get their heads around how things work as much as possible, and then educate those people from outside of finance as to how things work. And that's something we do on a regular basis, so really trying to break down any of those barriers and make sure as many people as possible sort of understand how things work and specifically, how to create maximum value for taxpayers' funds. So within FACE, there's a recognition of the training that's undertaken. So there's a log for recognising your training. So I guess FACE has got two parts. It's got the sort of sign up part, so you can sign up to be a FACE. And then the second part is the accreditation process. So there's 3 levels here, level 1, 2, and 3. And they're aligned with the Future Focused Finance accreditation process. So at level 1, you'll need 1 person with level 1 accreditation for FACE. For level 2, you'll need 1 person that's level 2, and similarly for level 3 as well. So you record your hours online. There's a host of resources as well available for people. So we've got presentations, videos, events, all available on the One NHS Finance site under Finance for Clinicians. So I think if you are thinking about setting up training for non-finance staff, it's a good place to go, because there's some templates there that you can start using that really try to explain things in a decent way. So how are we doing across East of England? So this is a chart showing the different ICBs across the east of England, the number of faces that we've got signed up. So Norfolk and Waverley, quite proudly, which we're a part of, is at the top at number 23 faces. And within Norfolk and Norwich, we've got 11 members of staff that are signed up currently. So that's something we're quite proud of within our trust and within the region, but we also want to help others get to a decent level as well. And even, you know, the ICBs towards the bottom still have hopefully one per organisation, which I think is really the sort of minimum. So what have we been doing at NNUH? So this photo here is of our CFO delivering one of our face-to-face courses that have happened over the last couple of years. So, you know, as we're all aware, lots of training has been done virtually since the COVID pandemic hit, but we do like to get in the classroom and really engage with clinicians. So this is one of our training courses, which is aimed at sort of junior doctors wanting to develop more. So it's a program which has been developed through our postgraduate training course entity, and Stephen's going to talk about that in a little bit. But it's really emphasizing the point that we want to engage with as many people as possible for them to understand how NHS finance works, what the restrictions are. You know, it's not a limitless pot of money. So, you know, for clinicians making decisions, how does that impact on the finance world? What are the implications if they want to put something in? So what we do in these classes is look at a business case. So what are the implications of those sorts of things? So it's really ensuring that, you know, we're sort of striving towards financial sustainability and, you know, ideally making sure that there's enough money to you know, carry on sustainably. So moving on to options to consider. So face-to-face versus virtual. Well, face-to-face, we've had an example previously of some of the courses that we do. A lot of the courses that we do run are virtual across Microsoft Teams, and I think both work well at different times. So obviously, virtually, we can reach quite a big audience today across the country. It's not something that's easy to do in a face-to-face scenario. I would say engagement is always higher with face-to-face sessions. You know, getting people in a room together so they can have a discussion around certain aspects or project or workshop always works really well. Then you've got the consideration of mandatory versus non-mandatory. Our finance training that we do is non-mandatory, but we've had examples from other trusts where they do set as mandatory. And some of our training, are sort of smaller modules on ESR, is mandatory, and we've seen a huge uptake in compliance for some of those courses. We've got a fraud course that went from 17% to 95% compliance when we made it mandatory. But it's really taken into consideration whether you want everybody to have to do it or it's an encouragement for people to do it. We've benefited from getting a clinical champion on board, so we work quite closely with that person, building the training courses that we have available to staff. We also want to ensure a broad range of training accessible to all. So we do formal training, but we also do informal sessions as well to different groups. And I think the informal works well when you're looking at smaller areas and people might have specific questions on that particular cost centre or division. We do encourage all staff to become a face. So as you can see previously, we've got 11 people signed up, and I think it really helps sort of share the load across the training that we have to offer, ensuring it's not just the same people delivering the training courses each time. And one thing we found works really well is varying the time slots of the training. So I think previously we'd set it on a Thursday at 11 o'clock, for example, but if there's somebody that never works on a Thursday, they're never going to be able to attend that training session. So when we've set out the training sessions going forward, we've ensured that they're varied, both the time of day and the day of the week, to ensure maximum coverage and uptake. Feedback is also really important. So we take on board all the feedback that comes through. We send out a Google form after the end of each session, and we use that to tailor the future sessions going forward as well. And if people do want further training, we point them to particularly HFMA bite-size courses, which we encourage our finance staff to do, but anyone who's outside of finance who wants a deeper understanding and a better knowledge, we encourage them to sign up to those courses as well. Just talking about some of the highlights within our trust. So we've talked about the finance educators we've got 11 within the team. We've delivered our monthly finance training sessions to over 400 members of staff. Most of that has been virtual, but we look to roll out some of that face-to-face going forward. And separate to that, we've developed business case training. So we've got a sort of group of our policies and procedures and governance around business cases. And as a separate strand of training, we've delivered that to over 200 members of staff. Now, Stephen's just going to talk briefly about some of the face-to-face training we've developed as well.
Thanks, Tom. Yes, as Tom mentioned on the previous slide, that we try and take a varied approach to both virtual and face-to-face, and quite a lot of our face-to-face training has been with clinical staff, partly as part of their own courses. So we've run a couple of different courses which we participate on in terms of clinical leadership, and we tend to make sure that we cover the macro perspective, so understanding of some of the basics, if you like, some of the flow. But Tom mentioned earlier that we tend to also look at using live or real business cases, so things that people can look at, consider the different type of options, make it more engaging, make it something that they can relate to. And we found the feedback. So when we first did it, we talked through what might be make up good elements of a business case. And some of the feedback we had from that was actually, could we, do a bit more hands-on, make it a little bit more interactive, consider different elements to it, and interestingly, different groups of staff react in different ways to that. So the two, the iLead and the Developing Clinical Leaders courses that Tom mentions on the slides. So iLead is the junior doctors one, which you saw a picture of earlier. Developing Clinical Leaders is for those more senior medics that are looking to move towards becoming a consultant. And the difference of the discussion and the richness of debate in those are quite different. So pick up on very different types of things which they might expect to see or want to be included in a case, depending on where they are in their career. That's really helpful in just trying to both get the engagement but get the pitch right. And one of the things about getting that pitch right is that actually you have a room of engaged clinicians that are learning the things that that we want them to be able to learn, understand, and share with their colleagues, but also add to our own development. So it's as much useful development for us as it is for them. And that's really valuable in terms of getting our face development. So our own finance teams, not simply transmitting, but doing the interactive stuff is really valuable. So I've led on quite a number of those, but we've started to have different members of the team go out and present it. People with experience of specific business cases. We tend to use different business cases, ones that everyone recognises. So they're normally trust-wide developments or things that are perhaps more likely to be in the press, for example, or higher profile, so that actually the things that people recognise and think I can visualise that, and that's been really helpful. The other bit that we have done, so we started doing some courses across the ICB, and that's been quite challenging, because we can't rely on local only examples when we're trying to work through things, and the development of those courses has been a little bit more taxing for us as we've been trying to pull them together to cover the different organisations across the ICS. But also, again, it changes that conversation, and people get different perspectives from different organisations is really valuable. And the feedback for those has been really positive. We do those ones in person as well, and where we have run them both in person and online, the engagement in person with people in the room has been a lot better. So we have done them virtually as well, but they tend to be, people are less likely to be engaging and sharing because of the way that Teams works. We've got it today. There's probably 30 of us on the call, and you can't see everybody, and it makes it more difficult for people to contribute when we're trying to do that as a training source. So we do try and do it in different ways, but as again, we also do with corporate areas, and sometimes we do that bespoke. So Tom's reference on slide there, finance and procurement governance, so that was as a direct result of some gaps in knowledge and new people starting in departments, and they asked us to do something separate. So we do that. So we try and make sure that we are reactive and responsive to the needs where people say it, rather than us providing something which we think everyone needs to hear. And that's been really helpful as well in terms of getting it bespoke, but also getting that engagement. We've done that with HR, estates, a number of different areas where actually they are able to have that focus and those kind of individual sessions that they've requested, and that's been really helpful in terms of the engagement. People are more likely to turn up if it's something that they've requested at a time that suits them, which is one of the reasons why we changed some of those drop-in and monthly sessions that we've previously done, from being, as Tom said, they were always at the same time or same day of the week, and that meant that we were almost actively pushing people away from doing some of that, and we've got much better take up since we've started moving it around, and we're being more flexible with it. So if people ask us to do things, that we do it, and I think it's really important that we've responded to some of that feedback, and that if you're doing it in your own organisations, to look at what works for you, and try and make sure that actually it doesn't just work for one pocket of your organisation, but actually is able to go much more broadly. So I'm conscious I've rattled on a bit there. Tom, did you want to move on to the next page?
Yeah, sure. Yeah, thanks. Yeah, so moving on from what Stephen was talking about in terms of training and how we deliver it, we've looked at some of the feedback we get. So this is some of the comments we've received from the Google Forms that we've put out, some of the positive feedback. So we'll move on to some of the constructive stuff in a little bit. But things like being very informative, good content, helpful trainers, should have had this years ago. So that's an indication that hopefully we're doing things right now, and maybe we've sort of moved on from where we were previously. Comment around useful to understand in terms of SIP and HRG. That's something we do go into detail about, but there's going to be lots of terms that are difficult to understand for people, and we have put together a finance glossary to answer some of those questions around what does this mean, what does that mean, both in terms of 3-letter acronyms, but just accounting terminology as well. And the last point, it was good to have multiple speakers. So that's our point around trying to share the load a bit in terms of the number of presenters we have for each course. And this is just some feedback on the face-to-face courses that we've run. So finance team have been very helpful in working with myself and the team in Nanami. That's the postgrad team. Talked about a tailored approach and continue to make changes as the environment around us changes. So we've talked about the business case example that we use. We'll look to update that as and when another project or another business case is sort of front of mind. But we're continually looking to update these courses and refresh things so that it's relevant and focused for the training that's ongoing. So talked about engagement and what we've done. There are a load of interactive tools. So some of you may have used some of these already. Slido is our current favorite. We integrate this into the presentations we do for online, but it can also work in face-to-face as well. Mentimeter is very similar to that. So it's for creating questions and polls and quizzes that are easy to access. Kahoot is an example of something similar, but it is really a sort of quiz-based gamified solution. But I've seen that work really well in training sessions. And Wheel of Names is just another example. If you're looking to sort of give a prize out to somebody or ask somebody for some feedback, you can put names in there and it will spin the wheel. As well as that, we've got Microsoft Teams for polls. We're actually going to try this now. We've got a poll hopefully ready to go. If I just reopen the poll, it should hopefully pop up. Just asking you, what interactive tools have you used in training? So either a training course that you've been on, that you've delivered, or something where you've been a participant. Have you used any of these tools, or have you used something different to these? There's quite a few available on the market. I'll put my options in there as well, so that it comes up. We can include polls on Teams now as well. You can do multiple responses on there. So I think it looks like biggest responses for Slido so far. 32% of people have used that. We do find it a great tool. You can integrate it directly into PowerPoint. So as you're presenting, it will pop up with the actual Slido questions as you're going along. And it's a very useful tool to use. As well as polls within Teams, you've got breakout rooms. So people that haven't used them, it's a chance to create a different room with a different group of people to your overall meeting. So for smaller workshop groups and breakouts, it can be very useful. Well, it does take a little bit of time to kind of set up and use. In addition to that, there are different ways to present as well. So typically we use the standard presenter mode, which is what we're using today. But something that Zoom's had for a while is the standout view, which is now within Teams as well. So if you're kind of used to pointing to certain things in slides, then this is a great way to do that. It's you in front of your slides effectively. You can have side-by-side and reporter view as well, and you've got the option to change the size of the slides. So all of this sort of makes it a little bit more interactive when you're developing things and delivering things online. There's also the option to not just have a meeting and have a live event as well. So we have weekly updates from the CEO and exec team that are done as live events. So similar to meetings, but no option to share your camera or audio. So the questions can be through the chat, which is useful, but perhaps not as interactive as a meeting. And then webinars is the next step, which needs sign up as well. So it's like a live event, but you'll be asked to sign up to it as well. So how do we support our staff within our trust? We've got a load of information on the finance intranet page. It will tell you who to go to for further information. It will reference training courses that are available, especially for our new finance system that we've got. It will give you further information on training like HFMA courses, the team structure, finance policies, and we've got the finance glossary on there as well. So any acronyms that aren't quite clear or made clear within the finance training, that's accessible to staff as well. So that was a bit background about what we've been doing. How can we improve going forward? We're constantly listening to our participants in terms of constructive feedback. There's some examples here from our training. Some people saying it went a little over my head. They would like more sessions on specific areas. So I think we really need to make sure we've got tailored sessions available for people that specifically want certain information on certain things. So there's an example about the SIP process down here. So having something separately describing what the SIP process is, or signposting people to the right area, is something we can develop going forward. So we ensure budget holders have sufficient training on our new finance system, continue to develop our faces. So we've got to ensure that we've got enough accreditation at each level, including level 3, as we're currently going for FFF level 3. But I also want to learn from the wider community. So I'll put it out to everybody in the chat now. Is there anything else, any other tools that anybody else has used that's been useful in delivering training? And that's the sort of end of the presentation now. So put it out to any questions that anybody's has in terms of what we've been doing, or questions on FACE development. Is everything very clear? It's been great to get representation from around the country today. Hopefully nobody's been snowed in. I've got a hand up from Dion. Would you like to go with your question?
Yeah, good morning. Thanks for your presentation. I'm from Samuel and West Birmingham Hospitals. We've just achieved level 1, and we currently have what they call budget holder trainings in place. I'm not from a finance background as such. I'm payroll. So I just wondered if any of your training for engaging staff across your organisation involved any aspects of that, or did that was that covered from a HR perspective?
Are you talking payroll specifically? Sorry.
Payroll specific, because obviously it impacts on finance. So I just wondered if there was anything that you tailored into any of your training, or is there a representation from payroll?
Yeah, our payroll is outsourced to SBS, so it's
Right,
outside
okay.
of the sort of core finance functionality within us. I don't know if you wanted to add anything on that, Stephen.
Yeah, so it's well, as Tom said, it's outsourced. But one of the things that we do as part of going through the training is we look at examples of budget holders statements so that people can see how pay transactions hit and the ability to drill down and investigate further, so actually they understand what's happening. So it's probably not in the level of detail that you might use if you've got an in-house service, but we do try and make sure that one of our biggest spend areas, over 60% is on staff costs and pay. So actually helping people understand that and what are the drivers in their pay spend areas and how they get that information is part of our monthly training update. And actually we're just going through and updating that, as Tom mentioned, with the change of systems, just so it's a bit more interactive so people can see a bit more. But we're always looking for ways to try and make it a little bit more real for people. So if you've got any other ideas or things that you think that we should or could add into ours, we're more than happy to take those on board. This is as much about us learning from you as you learning from us.
Thank
you. Thank you.
Yeah, Chris, you've got your hand up as well.
Oh, yeah, thanks, Tom. Yeah, I appreciate your presentation. Really, really useful. We're just working towards level 1, but I'm trying to log 5 hours, obviously, towards that. And I just wondered if, like, the development of such as like the glossary and some presentations that we could post on our intranet page would contribute towards those 5 hours, or does it have to be physically in a classroom or via Teams delivering training as such?
That's a good question. I think it's Natasha on the call from One NHS Finance. I mean, typically we've just allocated training time to that. I think we've got the advantage of, there's quite often training courses that we do that we can add to that time that we log. But that's not to say I don't think you can use other sorts of development, but it might be one to clarify with One NHS Finance directly, I think.
Cheers, Tom. I will do.
Excellent. We do have a question in the chat from Sheila. She's asked about logging one-to-one conversations we might have with clinical staff. We haven't done traditionally in terms of maintaining logs because we do offer quite a wide range. But in my last organisation, that one-to-one individual support and training was part of when I was first registering as FACE, and actually it's some of the most valuable training that you get in terms of developing as an individual as well as with our teams, because you get that immediate feedback and the understanding of how does it affect my service. So yes, any conversations that you're having with clinical staff that are kind of like working through and supporting them in understanding how finance works for them, you should include.
That's great, thank you. Any other questions? Coming through. Well, I just would like to thank everybody for attending today. It's been very useful for us to kind of showcase what we're doing here. Hopefully it's been helpful. I think the slides will be shared afterwards as well, and I think there's a video recording going up online as well. So there's nothing else. I wish you a happy Christmas and hopefully not too much snow out there. All right, thank you everybody.
Thank you, Tom.
Cheers, thanks, bye.